This episode is brought to you by my Fertility Management Masterclass. Master fertility awareness and improve your menstrual cycle health at the same time. Head over to fertilityfriday.com/workwithme for details. That's fertilityfriday.com/workwithme. This is the Fertility Friday podcast, episode number 122. Welcome to the 122nd episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Now, as you know already, I started this podcast because I believe that every woman has the right to know exactly how her body and her fertility works. And for those of you who are wanting to go deeper into the realm of fertility awareness charting and body literacy, I do have a number of programs that allow you to do just that. And I'm really excited to announce a brand new way to work with me. I'm now offering a one-time in-depth strategy session for those of you who are fairly confident in your charting, but still looking to gain a deeper understanding of your cycles. So for those of you who are wanting to go that extra step and get that customized interpretation of what your cycles are reflecting back to you about your overall health and fertility. And by the end of our 60-minute session together, you'll not only gain clarity and insight about your cycles and how they relate to your health history, but you're also going to leave with a plan, concrete next steps to take to improve your cycles naturally. So make sure to head over to fertilityfriday.com/workwithme to book your strategy session today. And today I'm very excited to welcome my guest, Lisa Leger, back to the show. Lisa is a Justice Holistic Reproductive Health practitioner, or are you a Justice Holistic Reproductive Health educator? Is that the correct term?
Yes.
Okay.
Well, I guess I'm both.
HRHPE.
I'm teaching at the college too, yeah.
Yes, practitioner and educator who trains fertility awareness practitioners like myself. So thank you, Lisa. She's been working in the field since 1988. She has an extensive background in women's reproductive health and fertility, and she also works as a natural health consultant in Parksville, British Columbia. And so as I had alluded to, Lisa was on the show last year in episode number 38, where we delved into using fertility awareness to navigate through menopause and perimenopause. So I definitely recommend that you go back and have a listen to that episode. I know some of you might be thinking, well, I'm young. I don't need to think about menopause and perimenopause. But I think it's really powerful just to understand the implications of continuing to chart your cycle through those years and how it can continue to help you. And also it kind of starts that thought process of how our health today, if you are kind of a younger woman before that perimenopausal phase, will kind of determine what that is like for you, the experience of perimenopause and menopause. So that's a tangent. But in today's show, we'll be talking about liver function and the connection between the liver and a woman's health. And this is such an important topic, especially in light of our current experience as women in this world. We're inundated with chemicals, hormones, toxins, xenoestrogens. We've talked about this so much on the show, but I think one of the things that we don't always think about is that our liver plays a huge role in removing those toxins from our body. And when we're overwhelming our liver with the regular things that we do every day, that can play a huge role in our hormonal health and our fertility. So without further ado, welcome to the show, Lisa.
Well, it's great to be here, Lisa. Thanks for inviting me back.
Of course. I was so excited. And when you suggested that we talk about the liver, I jumped right on it because we haven't really done that a whole lot on the show yet. So maybe you could just, for all the listeners who didn't listen to episode 30, I think you shared a lot about your experience and what brought you into this field. And maybe you could share just a little bit about what you're doing now, even your role as an educator.
Okay, sure. You're right. That earlier episode that we did, I did talk about kind of the history of Justice and how I kind of got involved and how fertility awareness evolved in my career as well as my personal life. To kind of continue on that theme, I guess currently working in a pharmacy setting, I'm seeing a lot of people who actually take prescription medication, of course, and the sort of complaints and side effects that I hear about are a lot of digestive disorders, a lot of complaints about intestine issues. People are being told they have fatty liver, their cholesterol levels are creeping up and all this sort of stuff. So I see the connection there with, diet and lifestyle and medication use and exposure and so on, and the impact that it's having on the liver, and of course, the liver being part of the whole digestive system, impact on that. So they're actually noticing and able to complain about pains and symptoms. But of course, we know the liver does all sorts of other stuff too. So we can talk about digestion, how the liver is involved in dealing with our food. We can talk about synthesis, how the liver is actually involved in making proteins and bile and other stuff, cholesterol included, storage of certain fat-soluble vitamins. But the main one that's going to interest us the most today is the function of the liver in protection and clearance, in actually breaking down toxins. So we can talk about that in more detail today.
Okay, well, let's get our feet wet and give the listeners a sense of what the liver does. Of course, the liver has a number of functions that could take about a month of podcasts to go through. But to give a general sense, a basic understanding so that we can start to appreciate and love our livers more for what they do for us, what is our liver kind of predominantly doing in our body?
Well, so we've got a number of functions. One of the major ones, and the first sort of thing that happens, is digestion. So the liver's involved in helping us digest our food, obviously, dealing with our proteins, our carbohydrates, turning sugar into glycogen so it can be stored in the liver. That's why I was saying, heartburn, gas, bloating, indigestion, cholesterol issues, all these sorts of things can be related to liver function as well, because the liver, of course, is attached to the intestine. So people with issues in the digestive tract, you want to be looking over at the liver, dealing with proteins, amino acids, and so on, sugars, obviously. There are immune cells in the liver called Kupffer glands that act like big macrophages and prevent bacteria or fungi or parasites or, debris of all sorts of kinds that's filtered out of the blood by those cells in the liver. The liver makes a number of protein components that's in the blood plasma, like prothrombins and coagulation factors. There's transport and binding proteins like your C-reactive protein that everybody talks about in relationship to inflammation in the body, for example, and insulin-like growth factors and so on. So there's a lot of compounds that are made in the liver that sort of interact with other cells in the body too. Fatty acid production, producing energy out of fats, making ATP, creating lipids like cholesterol, as I mentioned. And, the thing that we sort of think about the liver is, it's a great big filter. It just cleans out your blood. And that is a very, very important function of the liver. But it's doing all this other stuff too. So you think about it. The liver is a huge organ, takes up, a great big quadrant of the abdomen, kind of below the rib cage and pretty much from like about the middle of the body over to the side. That whole area where you put your right hand underneath your rib cage, that's all your liver right there. And I was raised in Canada by bilingual father. My dad was from New Brunswick, and a lot of our relatives spoke French. And there's an expression in French when you overeat, they say, "Oh, j'ai une crise de foie." It means I'm having a liver crisis. See, the French know that when they overeat, they're giving their liver extra work to do. So it's an expression at the table. When people say, "Oh man, I'm stuffed." In French, they say, "Oh, j'ai une crise de foie." It means I ate so much that my liver is bugging me now. Isn't that interesting?
That's really interesting. And, this brings up one of the things that you mentioned in your email to me, which I thought was really interesting. And it's also interesting. So, Lisa, yesterday, I spent the whole day creating a PCOS handout. I've had a number of clients who have struggled with PCOS. So I literally spent the whole day delving into different books and everything and really kind of hammering down at least like the general information. So I was creating this handout for my clients. So it's really interesting how all these things are kind of connecting right now. Part of my research then was about the insulin resistance piece of that and how when a woman is eating, say, too much sugar or just eating a lot, even in your example of overeating, then obviously when you eat a lot and your blood sugar levels are higher, then that puts pressure on your pancreas to release more insulin. And the insulin is what allows the sugar to go into the fat cells and get it out of your bloodstream. But if the fat cells then eventually are too full, like there's still too much sugar, then the liver has to take that out of the bloodstream and store it, right? And so I'm getting to my point, which is that in your email, you also talked about the foie gras. So is that how you say it, foie gras?
Oh, foie gras, yes. The duck liver.
Yeah, and
It's so delicious.
Yeah. And so I'll try to make this not too long-winded, but a little while ago I listened to this fascinating TED Talk, and I'll see if I can find it and link it in the show notes. It was really fascinating. But this guy, it has nothing to do with fertility, but you'll see my point. This guy was talking about foie gras, and he was talking about how to make that dish essentially, and how the French then use that process it's called gavage. Is that what it's called?
Where they force feed the duck?
Yeah. So so basically foie gras is a liver, like a dish, and it's characterized by, I guess, the fattiness of the liver. And in order to get the liver to turn yellow and to be fat, they have to do the gavage, which is the force feeding. So they literally put like a tube down the duck's throat and force feed it a ton of whatever the dish of the day is. So anyways, all of these things are connected. What you said about eating too much, and that interesting that it's the French then who also developed that process, who also have that understanding that eating too much puts more strain on your liver. How we make that kind of politically incorrect dish, the foie gras, by force feeding the duck, and how that, adds the fat to the liver and makes it, I guess, taste really good or whatever. But then that connection as well from that PCOS understanding of, if you're eating too much and you have too much sugar in your blood, your body has to get it out of your bloodstream or it's dangerous to you. And maybe you could start us off by talking about that relationship between overeating, high blood sugar levels, and our liver.
Mm-hmm. Yeah, the foie gras is a great picture. We're actually creating foie gras in human population through the common use of sugar in the diet. And they're finding like little kids having fatty liver disease. It's not from fat and it's not from alcohol. It's from sugar. And we know that the liver stores a certain amount of sugar in the form, or energy in the form of glycogen. But like you brought in the insulin, so insulin being a hormone, of course, and being part of the endocrine system, insulin produced by the pancreas to deal with sugar in the blood. Well, one of the ways it does that is by storing it in a fat cell. So there are actually fat cells in the liver too. So there's fat cells all throughout the body. And most definitely it's the fructose in particular creates this process called glycolysis that leads to fatty liver disease. The liver just basically can't stop storing. And there are insulin receptors on the liver cells. So yeah, it can get to be really terrible situation. And also overeating can drive up cholesterol levels too. So somebody who's got scored a high cholesterol reading at the doctor's office, there are diet and lifestyle changes that can be made, and in fact are supposed to be made before prescription is written. And doctors really are instructed not to reach for the prescription pad first, but really to talk to the patient about diet and lifestyle before prescribing a cholesterol drug. How often that actually happens, who can say? We all have our opinions on that. But bless their hearts, the doctors are very, very busy. They have to stick to their guidelines. They don't want to get in trouble with the college. So they sometimes do reach for that prescription pad because they just do not have time to talk to their patients about diet and lifestyle. And so that's why there's all us allied practitioners out here in the world who do have the time to talk to people about diet and lifestyle. So hopefully we can do some of that today.
Mm-hmm. Well, let's bring it back to the menstrual cycle so that we can get a sense, because, I mean, one of the main reasons, in a sense, that we're highlighting liver function today is because we really want the listeners to get a sense of the relationship between having a healthy, proper functioning liver and having a healthy menstrual cycle. And so maybe you could just share a little bit about how liver function is related to a healthy menstrual cycle.
Okay. So let's jump ahead there. We talked about how the liver helps us digest our food, helps us deal with our sugars, filters out, bacteria and so forth in our blood and all these wonderful things, storage of fat-soluble vitamins and so on and so forth. But the breaking down of toxins is the area where there's a lot of impact on reproductive health, because as we know, we're being exposed to materials that kind of act like estrogen in the body. And at this point, I'm going to invoke the camel. Lisa, you've heard about the straws on the camel's back many, many times.
Yes.
But this whole notion that, this chemical and that chemical, and added them all up together, and you end up with a toxic burden or a toxic load. So most of the holistic practitioners that you've had on your show over the years have talked about reducing our exposure to some of these toxic chemicals, because they can have their impact on us. Now, some of the chemicals that we're talking about specifically are the ones who kind of act like estrogen. They've been called xenoestrogens, or estrogen-like molecules from the outside world that are not created in the body. And these, of course, can cause havoc by acting like estrogens and interacting with estrogen receptor sites. So in a patient who's having trouble with their liver, you will see, like I said, sometimes digestive troubles, sometimes like overt intestinal or liver issues like gallbladder disease or high cholesterol or those sorts of things. But we also, hear complaints about nausea, dark or pale or tar-colored stools, swelling. You can get skin conditions. We think of the organs in the body that permit elimination. Those include, obviously, the intestines, liver, lungs, and kidney, but also think of the skin as an organ of elimination. And so when these other organs are overburdened, sometimes stuff will try to come out through the skin. So you'll get yellowy skin, you'll get itchy, rashes, and most particularly acne. So acne can be a sign of overburdened liver, and sometimes those people are prone to constipation as well. In terms of what we see in our charting clients, or a woman who's actually looking at her cycles and observing the changes that happen throughout her cycles, we might see the acne coming up at different points in her cycle. We might see period problems, cramps, bloating, premenstrual symptoms. There's a role that can have an impact on fibroids and endometriosis. They'll have a more difficult perimenopausal years. And sometimes those digestive or intestinal problems actually take on a cyclic nature, that there will be worse at different times in the cycle because of kind of what's going on otherwise in their cycle too. So one of the things that liver enzymes can be involved in, or at least detect, inflammation in the body. And we know that when you have more inflammatory process going on in the body, that can also be a sign that, well, I guess a cause of, it would be a better way to say it. If there's more inflammatory process, you can have more cramps, more difficulties, more discomforts, more bloating, more headaches, joint pain, and so on and so forth. So inflammation, once produced, will go wherever the sort of weak links in the chain are in the body, and show up as, oh, here I go, I've got one of those headaches again. So, the impacts can be tremendous. And to kind of tie it all back, not saying, these are all caused by the liver, but that the liver is playing a role in how these things all end up unfolding. And specifically, we're going to talk about how the liver breaks down toxins and also breaks down estrogen specifically.
Mm-hmm. Well, and you brought up something. I just want to quickly stay there for a second, which is kind of headaches. So, a lot of women reach out to me, and then when they start charting their cycles, they realize, okay, I'm getting a headache like around the same time every cycle. Maybe you could just share a little bit about that. I know you touched on the role that the liver might play in that, but just to kind of dive into that piece of it a little bit, because I know that there'll be listeners who say, well, man, I get headaches, a couple days before my period every cycle, or I get a headache at this time, and I'm not really sure why that's happening.
Mm-hmm. Well, there's so many causes for headache. It's really difficult to kind of pinpoint, but there can be things going on with inflammation specifically. And there can be more vulnerability to sort of inflammatory triggers, I guess would be the way to say it, at different phases of the cycle. So there could be kind of a hormone picture unfolding where more inflammatory process is allowed to unfold, I guess you could say. You could have more production of inflammatory compounds like that C-reactive protein or some of those prostaglandins being triggered in the body. And then again, that camel, most of the time we can carry the load and be quite burdened and still get on with our day and still accomplish our chores and so on. But there can be times where maybe that burden is just a little less manageable. And the slightest last straw added on could be the one that can't be cleared. So it was explained by Terry Willard, the herbalist from Calgary. He's out here on Vancouver Island now these days. But he talked about allergies in this context and said, you can clear a certain amount of stuff each day, and that's great. But if too many straws are added to the camel's back on other days, it might just become too burdensome. And then you've got the histamines and all these other prostaglandins and inflammatory compounds being produced. And then they're just going to kind of go into the body wherever those tendencies are, like I said, called the weak links earlier. So a person who is prone to headache, there's more swelling, there's more pressure. And then, that sort of cascade of symptoms can unfold. So, it may not be that there's any one trigger. It's more of a perfect storm situation where there's a number of influences, there's a number of factors. There could be things going on at certain phases of the cycle where maybe she is craving certain foods that could actually be trigger foods that provoke more inflammation. She can get away with eating at other times in her cycle, but eating it around this particular time may be sort of compounding and adding that last straw to the camel's back.
Mm-hmm. Well, in the camel's back analogy, it fits so well when talking about liver function. And because you can quite literally picture that we all have that general understanding of our liver. I'm assuming that our liver is helping to, one of the main roles is to kind of filter out some of those toxins. And so we have talked a little bit about xenoestrogens. And so the liver has to play a role in getting rid of some of those external toxins and chemicals and compounds that we're exposed to. But what I'd like to talk about as well is the role that the liver plays in clearing the body's own hormones. And I think that camel's back analogy is a really good one in that sense. So if you're exposed to a ton of kind of external hormones, then your body, in a perfect world, if there were no toxins, your liver would still be busy all the time.
Yeah, that's a really good point. The liver's got all its normal duties, and then it's getting all these extra straws added onto its camel's back too. So yes, it can clear a whole lot of stuff. Yes, it can produce a whole lot of stuff. Yes, it can cleave or oxidize all sorts of organisms and toxic materials and so forth. Yes, the liver does that all day long. It deals with, hepatitis and parasites and metabolic issues and bacterial things. And, it just goes on and on and on. There's phase 1 and phase 2 pathways. There's conjugation going on. The liver's got to do a whole lot of stuff. So when you add extra stuff for it to do, and this is what our culture has done basically, is we've taken a system that was working okay on its own, and we've given it a whole lot of extra work to do. So do you want to go to the liver? Because first I need to talk about how the liver actually does this stuff.
Yeah, let's talk about how it's doing its really heavy job now that we've given it more to do.
Okay. So basically there's sort of two ways that the liver can deal with toxins. It can either oxidize them, which removes a hydrogen component to its molecule. Basically, you're sort of damaging DNA and proteins in the thing. Knowing that it does this, the liver actually produces its very own antioxidant to protect itself from the very thing that it itself does, which is oxidizing these toxins. And so it produces glutathione. Everybody's heard about glutathione these days because it's thought to be an important antioxidant. And, companies are trying to figure out ways to make a supplement version of it. And there are herbal things on the market that sort of promote your liver making glutathione, which sounds like a good thing to do too. But, the liver just chugs along making its very own glutathione all the time to protect itself from its other thing it's doing over here, which is oxidizing these toxins. And then the other way that it can neutralize them or break down these toxins is by cleaving them. So here we're breaking the molecule in half. We're breaking the free amino acids down. They get turned into urea, which ends up in the kidney. So now if we were holistically oriented types, we'd be thinking, oh, I guess we got to make sure the kidney's working properly too, so that everything is all optimal. So remember, like I said, the skin, kidney, intestine, lung, and liver are all your pathways out of the body. So we want to sort of maximize the functioning of all those organs. And so there's where the kidney kind of ties in. So when you think about it, stuff that's passing through the liver either gets oxidized or cleaved, okay? In phase 1, there's a lot of oxidization going on. In phase 2, you've got some other things going on, conjugation reactions and enzymes and so on.
I'm sorry, could you just explain again the cleave part? How does that,
okay.
Just so that I am clear on what it's doing and how it's getting those toxins out.
Okay, let me try that again then. Basically, there's 2 ways that the liver can break down the toxins. They can either oxidize them or cleave them. Oxidizing them removes the hydrogen molecule, and this is a major pathway in the body. So by oxidizing a toxin, the liver manages to kind of break it down so that it can be eliminated from the body, neutralizes it in a sense. And then the other way is to cleave or break it in half or cut it or snip it in some way. So by breaking the molecule in half or kind of breaking it apart, you can free up these amino acids and the liver is able to convert them into urea. And then
so the liver converts the toxins essentially into urea and then you pee them out.
Right.
Okay.
It goes into the kidney. Right, exactly.
Okay.
So now sometimes those cleaved materials end up in the intestine as well, and then they have to get eliminated through the stools, and they can actually end up being reabsorbed through the gut wall back up into the bloodstream. And then you have these sort of partially pulled apart molecules floating around in the bloodstream too, who can still kind of act a bit like estrogen. If they're enough, tiny bit like estrogen, that they can go and attach to receptor sites and things like that too. So just because something gets oxidized or cleaved by the liver doesn't mean it's totally innocuous now. It still needs to exit the body. So it still needs to go through the kidney, get processed into the thing that the kidney can eliminate. And then some of it gets dumped into the intestine, and it still needs to leave with the stool and not be reabsorbed up into the system either. So there's a lot going on, but the body just chugs along and does this all the time.
Well, that's really helpful so that we can kind of because I think it's really helpful as well how you described all the different ways that our body gets all the things that shouldn't be in there out. Mm-hmm. And so I might not have every, but you mentioned the kidney, the liver, the lungs, and the skin.
Yeah,
and the
intestine.
And the intestine. And so I think it's really helpful to get that kind of understanding of what the liver's doing. So the liver is processing these different chemicals and toxins in 2 main different ways. And then using your bodily kind of excretative, if that's a word, processes to get them out. And so essentially the way that they can come, like the way that our body eliminates them is either through our urine or when we have a bowel movement. So, I mean, right away when you talk about how if it's not evacuated in an efficient manner and time frame, that these toxins or estrogenic factors can be reabsorbed, it immediately speaks to then the importance of having regular bowel movements, the importance of having good digestion, and how all of these things are related. Because obviously, if your digestion is off, and then if you're not having regular bowel movements, then your liver is doing all this work to try to remove these things, and they're just being reintroduced kind of cyclically, and that's putting an additional burden on the liver.
Exactly. So way to spell it out there, Lisa. That's exactly it. So that's why the camel analogy is so useful, because you think about, things that we do and expose ourselves throughout the day. I really want to invite people to think about, am I adding more straws to the camel's back? Can I handle this even from day to day? Maybe there's foods or chores or tasks where you're going to be exposed to certain chemicals or so forth. And you have to decide, is this a good day for me to do this or not? Maybe you're going to paint the room or spray something in your backyard or, spray some poison on a wasp's nest in your yard or something like that. Is it the day that you want extra straws on your camel's back or not? Mm-hmm. And, how are you going to reduce your exposure to those things?
I know one of the things that I thought of kind of as I was preparing for our interview too was that I think I don't know if it's Finland, please correct me if I'm wrong, but there's some countries where people do sauna. So where sauna-ing is a thing that people do regularly and often. And so you mentioned that, the skin is one of the ways that our body can release toxins. And so there's other cultures, just like you mentioned, that the French kind of have this understanding of the pressure that we put on our liver when we're overeating or eating too much sugar or whatever the case. Other cultures have that understanding as well, that there's different ways that our body can detoxify and kind of incorporate those practices into their daily lives, whereas we don't necessarily do the same thing. So it's important to kind of understand the different ways. There's only so many ways that our body can get rid of toxins.
Right. So it spells the word skill: skin, kidney, intestine, lung, liver. Skill. And you can memorize that word to help you remember what all those different channels are to exit the body. And what we want to do is support those organs of elimination so those processes can happen. So we want to avoid constipation at all costs. And certainly if a clinician is working with somebody and they do think that the liver may be an issue, make sure the intestine is sorted out first before you start doing a liver detox or cleanse or any sort of thing that's going to make the liver dump, because you got to make sure the intestine is up for the task of eliminating whatever materials the liver ends up managing to dump. Mm-hmm. So people are often encouraged to do some sort of cleanse or detox or go on a little fast or things like that. We really want to talk to those people and make sure that the channels of elimination are in fact open. When people do these sorts of detoxes or cleanses, they should be dry brush massaging. Yes, they should be sauna-ing. Yes, they should be making sure that their skin has the opportunity to eliminate as well. Don't be using antiperspirant that blocks off your ability to sweat from the armpit. That's an exit. That's a way for stuff to get out. You don't want to block that off. The same with kidney function and, take some exercise where you do some deep breathing, make sure the lungs are engaged and so on too. So, we can remove straws from the camel's back, but we can also help to make sure that the channels are able to eliminate, because really, our bodies are doing this all the time for us. That's why we're not big piles of toxic material all the time, because our bodies have cleared and will continue to clear and are clearing this very moment as we speak, all sorts of chemicals and toxins that we're being exposed to all the time. So we can reduce our exposure as much as we like, but we still have to rely on our organs of elimination, the queen being the liver, to help us deal with the stuff. Because as you alluded to earlier when we started this, our very own body is producing things. It's not even necessarily the stuff from the outside world that can get us into trouble. It's our very own hormones that our very own body produces too.
Well, and I want to get into that, and I'm kind of taking a meandering path to get there. And so I want to throw hormonal contraceptives into the mix now and talk about how a history of hormonal contraceptives, or for a woman who's listening who's currently using one form of hormonal contraceptives or another, how does that impact their liver function?
Oh my gosh. The pill, we could indulge in slagging the pill for hours, but let's just suffice it to say the pill is not a straw. It's not a straw on the camel's back. It's a log, okay? It's a huge burden. It's not a straw. So the pill profoundly impacts numerous body functions. You are, first of all, introducing a synthetic estrogen so that somebody can profit off of it, because you can't patent a naturally occurring substance. You have to change it slightly so that you can sell it in a package. And you're definitely adding more straws to that poor old camel's back. And I'm talking a huge, enormous cedar log, like the kinds that drive down the trucks out here in BC. That's what the pill is on this camel's back. So there you've got xenoestrogens coming in that the liver now has to break down and process. Profound disruption of all sorts of endocrine functions. You recently had a guest on about the hypothalamic adrenal and ovary axis and how all those adrenal endocrine organs are talking to each other and how they're interacting with each other. This is a very intricate system that's just being disrupted for the sake of, don't even get me started, but all sorts of commercial reasons. So yeah, not only are we adding burden to the camel's back and specifically extra work for the liver to do, but we're disrupting the endocrine feedback loop in very, very harsh. It's like a sledgehammer approach to tweaking the hormones. So the pill is a huge impact on women's health. We're learning more and more about it all the time. The recent study of the side effect of depression being more predominant in women on the pill is just one more drop in the bucket of, the numerous side effects, and we shouldn't even call them side effects. They are effects of hormonal estrogens on the body.
Introduce the concept that maybe there's no such thing as a side effect. Maybe it's just an effect.
It's an effect. Let's just face it. Yeah. So these xenoestrogens that are taken orally or that we are exposed to in various ways through bleaches, they tell us we shouldn't microwave our plastic containers because chemicals from the plastic can leach out into the food that are kind of estrogen-like in their structure and so on and so forth. So people that are listening who put their stuff in a dish before they microwave it, try to recycle, try to avoid chemicals, and don't spray pesticides on their garden and so on and so forth, they got no business being on the pill. Because if you're going to make all these efforts to avoid all these chemicals and still take hormonal birth control, that's just illogical because it's one of the most profound impacts that you can have.
Well, and so then when a woman has taken it, and one of the things too is that, and I always say this on the show, I mean, I've taken hormonal contraceptives too. So it's not like we're saying, this is more of like to really get an understanding of what it's doing to the body and to be really clear on it. The biggest thing I have to say about hormonal contraceptives is that I'm not necessarily saying that no one should ever take them ever, but I am saying that if all women knew the impact that hormonal contraceptives have on your body, the way that it works, so that you understand how it's disrupting your normal, delicate, complex, intricate hormonal system, I think women may choose to be on it for shorter periods of time. I think that's what would be I don't think that women would necessarily never use it, but I feel like with this knowledge, you would probably, instead of ignoring your intuition, how your gut tells you like, man, it's been a long time that you've been on the pill, and how we just ignore it. Because our doctors, and then you ask your doctor, you say, I've been on the pill for 6 years and I'm kind of worried because I know I'm going to want to get pregnant. The doctor says, no, it's okay. Just take it until you're ready to conceive, and just, you can get off it and try to so really we're ignoring our little intuition. So I think if women had the knowledge and information, it's not like they would never take it, but we would have that informed decision to then anyway. So that's a tangent. So then for those of us, which is most of us, who have taken hormonal contraceptives, how does it impact our liver function? One of the questions I get a lot is, how long is it going to take my body to detox from that? Is it a quite literal getting rid of the estrogens that you've been ingesting, or are there more far-reaching effects?
Yeah, there are more far-reaching effects. So a lot of times in medicine, they think about how quickly does the drug clear from your system. And that's all fine and dandy. Yes, the liver can break stuff down, and yes, things can be eliminated from the body, as we discussed. But the repercussions that last aren't necessarily because there's toxic materials still floating around in your bloodstream. The repercussions can be because the actual endocrine system has been disrupted, disordered, and has to basically relearn how to do its job again. And so you run into a system where the cycles haven't returned to normal yet in a post-pill situation. And a medical person might say, well, I don't understand that. The drug should have cleared your system by now. But it's like the woman is still left with maybe low thyroid function, or maybe a pituitary that doesn't know how to do its feedback loop with the ovary there, or other aspects of the situation that haven't come back online yet. So it's not all about whether the materials in your system or not still. It's what's kind of left behind from the wreckage of having had your endocrine system suppressed for a number of years. So yeah, that's a whole other topic, and we can talk about sort of rehabilitating the cycle another time. But the body has an amazing ability to repair, to maintain, to store, and to restore health. And so often all we need to do is kind of help it along a little bit. And the liver is the perfect example of that, because the liver can regenerate cells. One of the few organs in the body who can actually grow new cells and repair and regenerate itself. It's really a very resilient organ. So it can take a lot of insult, and it can, oxidize and cleave a whole lot of material. So we're really lucky to have a functioning liver to do all this stuff for us. Now, when we give it extra work to do, of course it's going to put stuff on the back burner, and it's going to permit things to continue floating around in your bloodstream that it just can't get to right now. So if it's busy dealing with a whole lot of sugar or a whole lot of, this or that, it's going to let those hormone-like compounds just kind of go by this time. It'll just let them stay in the bloodstream because it's busy dealing with this stuff over here. Okay. And then that continues and that's how you end up with sort of like elevated levels of things in the blood that the liver normally would have dealt with. And so in live blood analysis, for example, they can actually see bacteria floating around in the blood or viruses or so forth. And so those things should have been dealt with by the liver. And if it's overburdened, maybe those things have been allowed to just kind of float on by and keep on being in the bloodstream. And so that's how we can end up with these conditions that are associated with excess estrogen. So like I said, fibroids and endometriosis are the two examples, but there's other situations where there could be a clue that the liver may be involved, where you kind of put the symptom pictures together and you think, yeah, this woman would probably benefit from a liver detox or a liver cleanse of some sort, or maybe we should help her liver out. And so this is where we sort of get into the clinical experience. I think any of us could do with a liver cleanse at some point, but certainly it is indicated when there's a kind of a cluster of issues related to, you kind of see that the liver's probably struggling in this situation. And like I say, acne and so forth can be things too. Another one that's really weird is, the circadian rhythms, how different organs are more active at different times in the 24-hour cycle. The liver is most active at 2-3 a.m. And the medical people will instruct people to take their cholesterol drug before bed because they know that the liver is most active at night. And they figure because the cholesterol drug suppresses the liver producing cholesterol, that it would be good to have that drug going on in the nighttime where the liver is more inclined to be probably doing that sort of thing anyhow. Where I find it interesting is when people come in with insomnia, they're looking for a sleeping pill and they say, I got no problem falling asleep, but I keep waking up around 2, 3-ish or 4-ish. And I don't understand why I'm waking up all of a sudden. And that can be a sign that the liver is struggling too, because that's the time of the morning when it's most active. Mm-hmm. So all these sort of clues come together. You hear skin conditions, you hear waking up around 2, 3-ish, prone toward constipation. I always ask whether they've got their gallbladder or not still. That's another thing that can be associated with use of hormonal birth control is liver disease. So there's a higher risk of gallbladder disease in post-pill or women who've had a history of taking synthetic estrogens. So, there's a number of reasons why we would end up wanting to baby the liver.
Well, and in line with what you're talking about, maybe you could paint us a picture. So for all the listeners who are charting their cycles, want to know, how would I know? I mean, you mentioned that all of us could probably do with the liver cleanse, mm-hmm. but how are some ways that this shows up on the chart and it manifests itself on a woman's menstrual cycle chart? You mentioned some of the kind of indicators if a woman has fibroids, mm-hmm. and that is fibroids are associated with estrogen. So if you're not clearing estrogen, and it doesn't have to be foreign estrogen. It can be a combo of foreign estrogen and your own. But if your body is not sufficiently clearing those, then fibroids can be an indication then that, because that's, the more estrogen, the more they grow. But what are some of the ways that a woman who's listening might be able to look at her own cycle and see whether or not this might be an issue for her, that her liver isn't necessarily functioning optimally?
Well, the things that I talked about already, like the prone toward constipation, skin issues, digestive troubles, gas, bloating, indigestion, constipation, diarrhea, food reaction sensitivities, all that sort of stuff can be sort of traced back to the liver. Even just sort of like, if you get stinky pee when you eat asparagus, that can be a sign that the phase 2 pathway in the liver is kind of not functioning optimally. Now, I know that it can be a genetic trait. Some families just tend to get stinky pee from eating asparagus, and some families tend to not get that. But, there's a number of things that are going on that the liver's just involved in. So it's not necessarily the cause, but it would be a way of lightening the load. So it comes up generally when there's a constellation of other factors that make it make sense. But specifically with the estrogen, when we're talking about things that are cycle related or hormone related, there's a really clear indication for helping the liver deal with estrogen specifically that I'd like to talk about, which is the indoles and the idea of using a herbal remedy to support estrogen conversion specifically. Would you like me to get on to that topic now?
Yeah, I think that's because the whole concept of estrogen dominance,
exactly.
too much estrogen, and helping your body to clear some of that.
Okay. So specifically the role of estrogen and in liver function, we got to kind of go back to some of the different types of estrogens that are produced in the body. So there's like the 3 major estrogens. There's other forms of estrogen, of course, but the 3 sort of major ones that most people are interested in is the estradiol, estrone, and the estriol. So the estradiol and the estrone are both produced by the ovary, and us fertility awareness types know that estrogen is produced by the ovary as we approach ovulation when the follicles are active. And estradiol is the strongest one. And this is the one that, sort of Western scientific medicine figures is, let's go with that one because it's the strongest. It's going to have the most effect. And so a lot of the synthetic estrogens are kind of modeling themselves after estradiol because, of course, our drug makers like to use the sledgehammer as often as they can. The other one is called estrone, and it's also produced by the ovary, and it's really quite abundant and quite strong too. Now, both of these hormones that are produced by the ovary, they go in the bloodstream, they do good things for you, they help your bone density, all the sort of nice things that we hear about estrogen, all the good things that it does for us. They even have some indication that it might favorably impact the artery walls and lower cardiovascular disease risk and do all this kind of great stuff. So sounds lovely. Having estrogen is when it's peaking around ovulation, a lot of us feel really good energy and we feel more kind of flirty, more libido, maybe easier to orgasm and so forth. So there's a lot of really nice things about having our estrogen levels peaking now and then. Now I'm talking about our very own estrogen that our body makes. So these 2, estradiol and estrone, come out of the ovary and, of course, go out into the bloodstream. And where do you think they end up? They end up getting filtered through the liver, of course, because all the blood goes through the liver, right? Now, when those get passed through the liver, they are converted to estriol. And estriol is a weak, short-acting, and protective form of estrogen that's really very, very good for us. Okay? And some of the phytoestrogens or the plant estrogens that we know about, things from, soy or red clover or, these other sort of estrogen-like compounds that we find in nature, they actually help the liver do this. And also iodine helps with this conversion too. So we're getting our, stronger, more active estrogens from the ovary, filtered through the liver, and converted into this weaker, more protective, more beneficial form, which we call estriol. So the way that science is kind of assessing your risk for breast cancer these days is by comparing the ratio between these. So when you take your levels of estradiol and estrone and add those two together, and you compare it to how much estriol you have, you can get a sense of how high that woman's risk of breast cancer is, based on the fact that estrogen makes cells grow, and estrogen can actually make abnormal cells grow in a situation where cells are misbehaving under estrogen stimulation. So this ratio between the estradiol and the estrone compared to the estriol basically is telling us how well the liver is converting. If this conversion isn't going on and we don't have very much estriol, our risk of breast cancer is increased because we've got these stronger, more kind of aggressive forms of estrogen in our bloodstream. Okay? So now the liver takes those things and breaks them apart, and under the influence of other compounds that are also present. And then you end up with estriol, ideally, hoping that everything goes as planned. You're going to end up with this nice active form of estrogen called estriol, and everybody's happy. But unfortunately, that's not exactly what happens because of all that back burner stuff I talked about, how the body's got all this other stuff to do, and sometimes things just don't go the optimal way. We can end up with that conversion not going on and end up with actual metabolites who can cause trouble in their own right. So metabolites are basically sort of byproducts of this process. So if this conversion winds up happening, these metabolites can also be measured and can also be assessed as to their risk or benefit to the body. So we've got, hydroxyestrogens. There's a 2-hydroxyestrogen, which is really great. It's an antioxidant. It controls cell growth. It reduces cancer risk, protects heart and circulation. That's where they got the idea that HRT would protect women from heart disease. The whole Women's Health Initiative study was sort of based on that idea that, certain estrogens are good in the body. Why don't we give everybody synthetic estrogen and expect the same result? Well, obviously that study didn't pan out. And so the Women's Health Initiative told us otherwise, that we can't expect synthetic estrogen to do the benefits that our very own estrogens do for us. So this metabolite, the 2-hydroxyestrogen, was kind of involved in that whole misunderstanding about the benefits of synthetic estrogen. There's the bad one, which is the 16-hydroxyestrogen. This one increases obesity, increases risk of autoimmune disease, actually causes more estrogen receptors to be produced. And it's kind of sort of okay because it also supports bone health. So it's kind of doing some good and some not so good stuff. And then the really, really ugly one is the 4-hydroxyestrogen, which increases risk of fibroids, cancer, toxicity in the uterus, causes damage to the DNA, so damages cells, generates free radicals, probably contributes to heart disease, autoimmune disease. And these are the ones that environmental chemicals sort of trigger. So when you have a lot of chemical exposure that acts like estrogen in the body, this is where it ends up being converted in the liver to this 4-hydroxyestrogen metabolite, which can really cause havoc. So what are we going to do about this? Well, we can reduce our exposure. We can help our liver out with herbs like milk thistle and dandelion and artichoke and red clover and burdock and all these other lovely herbs that help your liver out. And you'll see them in most of your milk thistle combos if you go looking around at the herbs section. But there's one in particular that's really remarkable in its effect. And that is the diindolylmethane, or we call it DIM for short, DIM. And you notice I said indole. So what do you know about indoles so far?
Well, that's a compound in certain cruciferous vegetables like broccoli and cauliflower. You'd have to eat a lot of broccoli to get the same effect as taking DIM or indole 3-carbinol, for example.
Exactly.
But yeah.
Very good. Yeah. So these indoles, though, another example of where they're found is in the flaxseed. Do you remember the great study that convinced everybody that they should eat ground flax seeds to reduce their risk of breast cancer?
Mm-hmm. Yeah.
So to this day, you'll see ground up flax seeds on the shelf, and people will add those to their smoothie or dump it on top of their granola or so forth. So these indoles are found in the flax seeds too. And there was some really good research to show that use of flax seeds can reduce breast cancer risk. And this is, again, by the very same mechanism of action as these dietary indoles that you find in like broccoli and cauliflower and things that you've mentioned. So when you isolate these indoles, what some of our supplement suppliers have done is basically made an extract of sprouted broccoli seeds, made sure that it's got these indoles in it, and made it into a supplement. And so there's been clinical trials. They've even used subjects who've had breast cancer, history of breast cancer. There's a clinical trial where they gave them DIM, and they were able to show that they made more of the beneficial metabolites and fewer of the more dangerous, more aggressive hydroxyestrogens. So basically favorably shifting the estrogen metabolism. So as you mentioned, the indole 3-carbinol, the diindole methane, and the dietary indoles that we talked about as sources of those things. But yeah, you'd have to eat a whole lot of broccoli to get a therapeutic dose. So what we're suggesting with a supplement of this DIM is to really help the liver make this conversion. So if there are signs of excess estrogen, and we know that estrogen makes cells grow, and we know that this misbehavior can be dangerous, we really want to shift the liver to making the good kind of estrogen and not the form of estrogen that increases the risks. Mm-hmm. So the estradiol and the estrone, we don't want those flying around our bloodstream. We want those converted by the liver into the estriol. And this is one really good and efficient way to make that happen quickly for our clients, because we can get results really super quick with this. And I'm really pleased with the results I've had. I can find, foods that are good for your liver: the cabbages, broccolis, cruciferouses, the leafy greens. Turmeric is remarkably good for the liver. It acts as an antioxidant and helps support a lot of really excellent liver functions. And then, of course, you've got those herbs that I mentioned, like the dandelion artichoke, milk thistle, all that kind of stuff. So yes, those little milk thistle combos can be super excellent, but there's sometimes food just isn't cutting it and you just need a supplement. Mm-hmm. If you do a milk thistle combo, you probably only need to do it for 2-3 months. Any protecting and regenerating that's going to go on in the liver should happen, naturopaths reckon, in a couple of months. So a milk thistle combo isn't something you commit to for life. It's something that you do for, a couple of months. Maybe you go through a few bottles of milk thistle combo in capsule or tincture form, and then that should be good. So I'm talking about like a normal healthy person might do a milk thistle combo spring and fall, once or twice a year, and that would be adequate for them.
I just wanted to kind of wrap that up in a neat little bow, because I think that the way that you described the process of estrogen metabolism was extremely helpful. And I want us to take a moment to kind of sit with that for a minute, because it really gave us a clear kind of picture of what's happening. And so I just want to take us through that real quick. So it was like your body's producing its own estrogens, or you have the estrogens that are coming in, the Xenos, mm-hmm. and then your liver then is breaking these estrogens down. And I say estrogens because mm-hmm. we're under the impression that we have one because of the pill, but our body mm-hmm. produces a number of different estrogens. And then our liver is breaking those down. So if our liver is not functioning optimally, you described how certain metabolites, so it's kind of like byproducts of this mm-hmm. breaking down function of our liver that are thrown out into our bloodstream. And some of them are fine and some of them cause some significant problems. So if your liver isn't functioning, the way it should, then you have more of these metabolites then that are causing different kinds of problems. And I think it's really interesting to to think about that for a second and how it can play out. And also what we talked about with how the liver has to evacuate these estrogens from our body, and how if this whole system is not working properly, not to mention if you're exposed to a ton of environmental chemicals and you have more of those harmful metabolites as part of this process, that it's just you're not getting rid of them. They're just continuing to circle, and how harmful that can be in terms of growing things like fibroids, or contributing to growth that you don't want in your breasts, which can then put you at risk of say something like breast cancer or something like that. So I think it's really important to kind of understand then that these compounds are helping your liver to kind of more efficiently process the estrogens and evacuate them, and also to make the byproducts less of an issue for you.
Mm-hmm. That was a good roundup of it. I'm feeling like maybe I should do more on the DIM and talk about it in a more clinical way.
I wanted to ask a couple questions. So kind of like on behalf of the listeners who are all like, okay, oh my goodness, I think this might be me. I know that I was exposed to tons of xenoestrogens. My digestion is kind of off sometimes. I know that, I know I'm having some challenges with processing these things, and I'm really resonating with what you're saying. But one of the questions that I would want to ask you for something like DIM, if a woman is trying to conceive, and so it's kind of like every month, the ovulation, then she has that 2 weeks to figure out if she's pregnant or not. Is this something that she should be doing if she's actively trying to conceive? Like, how does this all work? Because we talk about liver detoxification, but then the practical aspect of it is, if a woman is actively trying to conceive, how should she be going about this liver detox stuff?
Mm-hmm. Okay. So the party line is don't detox when you're pregnant or breastfeeding. So I think most naturopathic doctors would agree that you probably shouldn't be doing liver detox when you're trying to conceive either. Ideally, these things would be done like in the post-pill years prior to attempts to start the family, or they would just be done as a project. It's not something you have to commit to for the long term. As I told you about my perimenopause experience, I used DIM to buy myself 5 extra years of cycling by shifting my estrogen metabolism into a more favorable position, so that I wasn't suffering from excessive estrogen type symptoms anymore. And so it only took me a month and a half to do that. So it's not something that has to be done over a long term. I think a woman could get good results, positive benefits, without a whole lot of time investment by using DIM. And that's why, eating healthy food and eating lots of broccoli is a great strategy in general for a lifetime. But if you're trying to treat a condition, then you need more of a dose. And so the clinical trial that I was talking about earlier, they got favorable results and they got the shift that they were looking for in 30 days, like 1 month. So it might, be worthwhile to just even take a cycle off and do that before trying to conceive.
Well, and you mentioned as well in terms of like doing milk thistles. So that's something you can get in a tincture, you can make tea with it and all that kind of stuff. But you mentioned that it's not something you just keep doing forever and ever and ever. It's something that you do for a period of time to support your liver, and then you let it be. So is this the same with something like diindolylmethane, DIM, or indole 3-carbinol?
Yeah, you do it for a short period of time to get the results you want, and then you don't have to keep on taking it. So normal things that we include in our diet to help our liver is like bitters, bitter tasting foods, bitter herbs, appies, things to open up the appetite. That's all great for bile production and for the liver. If you think you need to do like a detox or support the liver in some way, then usually a milk thistle combo would be adequate for 2-3 months. If you feel that there's a true situation of excess estrogen or misbehaving estrogen in the body where, there are symptoms, heavy menstrual bleeding, clotting, difficult periods, lumpy, painful breasts, things that we know are associated with excess estrogen, including certain types of menstrual migraines and so on, Jerry Lynn Pryor talks about that in her book, Estrogen Storm Season. She lists off all the different symptoms that can be related to estrogen imbalance. So in that sort of situation, I and many of my naturopathically oriented colleagues would suggest the use of DIM because you can get really good results and very quickly to support the estrogen conversion in the liver and get things pointed in a more beneficial direction. Again, that wouldn't necessarily need to take a long time. It could often just take a cycle or a couple of cycles to get that to be resolved. So it's really exciting, and I've seen some really dramatic results in my own practice with introducing DIM.
Well, and of course, I would always suggest to my listeners to, to take this for information because that's what it is. We are not doctors here prescribing anything. And so with all of the podcasts that I've done and all of the information that I share and that we share and that my guests have shared, when you're implementing something like DIM or milk thistle, you want to be cognizant that you want to be kind of under the care of somebody who knows what they're doing. Because one of the messages that I've shared on the podcast, throughout the years is that there's for example, if your diet is a hot mess and you've got a ton of gut issues and you're dealing with that proverbial camel's back scenario where you have a ton of things going on, DIM alone isn't going to fix your cycles. And so this is within the context of working with somebody who is looking at your entire present, what's happening with your body now, as well within the context of your health history. If you have a history of hormonal contraceptive use, if you have different health challenges that you've had, as well as your diet and your lifestyle factors, stress. So yeah, in no way, shape, or form are Lisa and I trying to suggest that, you're going to take DIM and it's going to fix your cycle. When Lisa's working with her clients, it's within the context of an entire care scenario over significant periods of time, and also having a kind of practitioner-client relationship with that person where she also has a clear understanding of the other factors on that particular client's back. So all of these things working kind of collectively in a way that you can't really explain on a podcast, like on an hour-long podcast. But as we kind of get to kind of wrapping up, Lisa, we could talk for so long, and I think I'll have to have you back so we could talk a little bit more about fatty liver disease, because I think that would be really, we wouldn't really be doing it justice because it deserves its own spotlight. But from everything that we've talked about today, what is one thing that you would want the listeners to take from our conversation?
Oh, okay. So just to kind of wrap up then, we talked about removing straws from the camel's back. So eliminating burdensome materials and exposures from the diet and lifestyle, facilitating the organs of elimination, remember skin, kidney, intestine, lungs, and liver, making sure that those channels are working properly and open, and then tweaking as required. So when the herbs and the supplements come in, that's once the diet and lifestyle have been addressed, obviously. And, everybody is on a path. We're all doing our best. We're all trying to, eat the organic, free-range, fair-traded food. We're all trying to reduce our exposure to pesticides and chemicals. We're not buying the bounce sheets anymore and all those sort of things that we do to try to make our diet and lifestyle as healthy as we possibly can. And it's all, of course, within our own abilities and what we can afford and so on. When we talk about actual interventions from the natural medicine approach, we can get some really dramatic results, but we do need to know what we're doing and we need to approach it in a systematic way. So make notes on your calendar. If you do try something new, make a note. If you try eating differently, if you introduce a herbal remedy into the program for a while, make note of what you notice. If there are changes in bowel movements, if there's changes in sensation, maybe you didn't get that headache like you normally do in the premenstrual phase. So make a note of those things because that's all really useful data. We have to practice self-observation. And one of the great sort of side effects of charting, regardless of why you're charting, is that body knowledge and that use of the chart as a diagnostic tool. You can monitor the impact of the interventions that you do just by looking at your chart and see if that stuff actually has made it a difference or not. So yes, I love talking about herbal medicine and the use of DIM. I've had some tremendous results in my practice. One woman canceled a hysterectomy that was offered to her for her fibroids and her heavy bleeding. She was offered, you've had your kids now. Why don't we just whack that thing out of there and you won't have to worry about that anymore. And so I persuaded her to take some DIM and another remedy that I can tell you about another time, proteolytic enzyme, in fact. And she's happy. It's been 5 years. She's still walking around with her uterus and didn't have to have a hysterectomy. So there's some really great results. I got 5 more years of cycling before my perimenopausal years. And a lot of women have less fibrocystic breast disease, lumpy, painful breasts around their period, and so forth. So we know that we can use natural medicines, and we do still have to use them systematically and sensibly. And so I think the charting is a really great way for us to stay anchored so that we can observe what we're doing and assess the results that we're getting. So thank you very much for wrapping it up like that, Lisa.
Oh, you're welcome. And Lisa, thank you so much for coming on the show, coming back on. One of my few repeat guests. It was really great to have the opportunity to chat with you and pick your brain, because I have to say selfishly that it's fun to have that opportunity. And so how can our listeners find out more about you or contact you if they have questions or just find out more about what you do?
Well, visit the Justice website. It's justice.ca. And I'm listed there as one of the holistic reproductive health practitioners. My email's there, and then you can get an idea what is involved with charting. If anybody's listening who doesn't chart yet, you can find out what's involved in charting. And check in with Fertility Fridays for more great information about reproductive health.
Oh, thank you. That was a fantastic endorsement. Well, thank you so much for being here, Lisa. Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/122. I hope you enjoyed the interview that I did with Lisa today. It was so great just having the opportunity to chat with her again and to really get into liver function and the role that it plays in the menstrual cycle. And it's so interesting being a fertility awareness educator and having the opportunity to see so many different women's charts and to kind of see how it all plays out. And it's really interesting to see how all of these things are interconnected. And so to see how if a woman's liver isn't functioning, optimally, how that can actually show up on the menstrual cycle. And so one of the topics that we talked about in today's show was estrogen metabolism and how, if you're exposed to a lot of xenoestrogens or different chemicals, that when your liver is trying to break those down, it can kind of break down into all these different metabolites, different kind of byproducts of these estrogens that can actually be harmful and go on to affect other tissues in your body in different ways. So it's really interesting to see how that process works and how that process of estrogen metabolism is related to things like fibroids, for example, or if a woman has estrogen dominance, which is a really interesting concept because I think everyone thinks estrogen dominance means you have like a super high level of estrogen, but all it means is that you have more estrogen relative to progesterone. And so in a perfect world, if your cycles were kind of, within that normal range, you would have about equal estrogen as you would progesterone. You'd have about as many days of pre-ovulatory, estrogenic follicular phase. So the first half of your cycle would be approximately equal to the second half of your cycle. And so the progesterone and estrogen would balance it out. But if you think about the way that Lisa described the process that your liver has to go through to break down some of these estrogens and the whole concept of evacuating these estrogens after they've been broken down or any of the other kind of chemicals or toxins that your liver is removing from your body, if you think about that whole process and the relationship between your digestive function and how efficiently your body is excreting all of these things, as well as the other pathways to get these things essentially out of your body, if they're not working very well, then you can kind of end up in this process where you just have levels of estrogen. So your body isn't really able to break them down properly. The metabolites then are produced. And then if your digestive function isn't working properly, then they just kind of keep circulating. So they kind of get reabsorbed, and then it puts an additional pressure on your liver to try to get rid of them again. And you can kind of see that this would be problematic. So what I really liked about just that part of it and just the whole concept of it is to really stress the importance of supporting your liver function, identifying if that's a problem for you, and understanding the role that that plays in this whole process. And there's so many different factors of this picture, so many different items that we've talked about on the show over the years, and how all of these things relate to each other. And so this is just another piece of the puzzle to try to get you to understand that your menstrual cycle is the fifth vital sign of a woman's health. And it's a thermostat that's telling you the status of your overall health. So if there's something that's off, for instance, your liver function or your gut health, or if you have chronic inflammation, or if you have something like uterine fibroids, or if your cycles are, all of these things come into play. And it's very interesting and exciting that they show up in the menstrual cycle, because that gives us a lot of information. And so kind of bringing it back to the point that our menstrual cycles tell us so much about our health. And then you can actually see the difference and the changes. If you do happen, if your liver is being kind of bombarded, and then you do support your liver, then you're able to see how supporting your liver can then impact your menstrual cycle in a positive way. And so a couple of things that I just wanted to mention that we didn't get a chance to talk about in the interview was some of the ways to kind of unburden the liver. And I think that when you're having conversations like this, it's super easy to think that what's the best way to unburden the liver? Oh, it must be to take something or to add a supplement or whatever. And one of the things that I'd want to put out to all of you who are listening to this episode is that you can support your liver without taking anything. You can support your liver by reducing your exposure to xenoestrogens. You can support your liver by looking at, all the products that you have in your house and, taking a peek to see what it is you can switch out for a natural alternative. So like your dish soap, is it full of, artificial dyes and fragrances? Your body lotion, are you lathering yourself up in like sweet mango body butter? That's a problem. Are you still using fabric softener for your clothes? And do you use washing materials that have, again, colors, dyes, perfumes, phthalates, all that kind of stuff? And, what do you use to clean your house? Are you using vinegar and water? Because you'd be surprised at how many things that can clean. Or are you still using something that gives that like chemical smell? So actually making those types of changes without doing any type of supplement can support your liver, because then you're unpacking what's on that camel's back. So going back to that analogy, I just want to leave you with that idea that it doesn't have to be that you go and take stuff. It could be that you start getting to bed early. It could be that you make a point of getting to bed before 10 o'clock every night. Because as Lisa alluded to in the interview, your liver is doing its thing at around 1, 2, 3 in the morning. And so one of the ways that you can support your liver is actually by getting to bed on time, so that your liver can do what it's supposed to do at the time that it's supposed to do that. So I want to leave you with that. I hope you found that helpful. And I just want to encourage you to think about it in that way, and even ask yourself, like, what can I do to reduce that toxic load on my body? How can I support my liver today? So if you've been enjoying the podcast, please look for it on iTunes and leave a 5-star review so that more people can find it. And make sure to head over to fertilityfriday.com and join my email list. If you have an idea for a podcast episode or a guest suggestion, send me an email at info@fertilityfriday.com. And I'd like to thank you so much for hanging out with me today. I appreciate all of you for taking the time to tune into the show, and also for reaching out to me and letting me know if you enjoy an episode. And I also really appreciate it when you share the episodes with your friends, if you think that someone that you know can benefit from it. And also you can take a moment to subscribe to the podcast. All of these things help to spread the word, to make the podcast more searchable, and to really just extend it to a broader audience. So as always, until next time, be well and happy charting.